So first of all, thank you for coming to Downtown Kamloops' third webinar. And here's the introduction of the KCBI team and our guest speaker. So as the Executive Director, Carl is the official ambassador and spokesperson for Downtown Kamloops. Samantha is our marketing graduate from Thompson Rivers University, and you will see her in downtown businesses doing marketing with her phone and eating. I know she loves the restaurants here. Joining in February, I'm the newest member of the Downtown Kamloops team, and what a start it has been. So, and our fantastic guest speaker at very appropriate time, Candice Burton has been an Occupational Hygiene Officer in the Kamloops office of WorkSafeBC since 2016. She has a master's degree in Occupational Hygiene from Montana Tech and is a Registered Occupational Hygienist from Canada, Certified Industrial Hygienist from the United States, and a Canadian Registered Safety Professional. Prior to joining WorkSafeBC, Candice worked as an Occupational Hygiene and Safety Specialist in the mining industry and was a reservist for the Canadian Department of National Defence. Candice, that is amazing. So much. Oh, unmute. Here we go. Let's get her unmuted. There you go.
Thanks very much, Christine, for all that, for having me. I guess we can get started into the presentation. Thank you for all taking the time to come and spend this time with us. I'm just going to see. I'm supposed to have controls. Oh, there we go. So, without further ado, let's get going. That's the way to start. Okay. So let me just move on to the next slide. Okay. So for some reason.
Not working for you?
Oh, I'm trying to switch to the next slide and it's not letting me.
Oh, there you go.
Perfect. Sorry for that. Okay. So we're going to talk about some basic things today. Some of it will be basic revisiting of COVID-19, what we know currently, what's the best way we know now of controlling the exposure to COVID-19 in the workplaces, what kind of support and resources we have available to assist employers and workers in ensuring that they are getting the right plans in place. And of course, we're going to have some questions and answers. Now, I'd really like to go not too quickly, but fairly quickly through the slide material. I'm thinking 20 minutes or less, because I'd really like to be able to have enough time to answer questions that are specific to you, and also saving some time to for those of you that are interested, going through, say, with something like hair and aesthetics or something, and just kind of helping you guys kind of go over what the expectations are and some easy things to think about. I know there's a lot of material out there and it can be a little bit intimidating. And I also want to mention that this presentation was built the end of April. So as everyone knows, we're hearing the words flying around: fluid, dynamic. You know, what we understand is changing regularly. So I will try to be cognizant of that, as there is some information that's new, and I have actually recently reviewed a lot of that. So hopefully the information and answers that I give you will reflect what's currently being put out there by the BC CDC, and of course Dr. Bonnie Henry and our own organization, WorkSafeBC. All right. So I actually am having a little bit of a delay. I don't know, Christine, maybe if it might be easier for you to take control of this, because my connection for some reason is, okay, there we go. Let's talk about symptoms and transmission. So a lot of this, again, is going to be review for people. We know that coronavirus is a virus, of course. It can have a range of symptoms from minor to more severe. We do know that some people are more vulnerable. We have people that have maybe immunocompromised systems, people over the age of 60, some can be more vulnerable, but there's also some evidence that younger people are also at risk. So for all of those obvious reasons, we are in a state of emergency with a number of rules in place. So the basic thing is if anyone is exhibiting any signs and symptoms that resemble cold or flu, you want to make sure that you're taking those next steps as appropriate, right? And of course, with transmission, we understand that the main mechanism of transmission is the droplets, right? It's the thick, heavy droplets that typically settle within your normal region, right? So we're saying 6 feet. Of course, that's evidence that's been collated by the BC CDC and other organizations going back. It's not the first time we've dealt with epidemics of this nature, but we know that those droplets fall out fairly close to the person who's generating them, and then they start to dry out and lose their viability, if you will. So the key with transmission, of course, is trying to keep those droplets from getting out there into the environment where they can go onto the surfaces or directly impact someone's eyes, nose, or mouth. What's really important to note and is with skin contact. A lot of people are wearing a lot of gloves and taking a lot of extra precautions. While it's good to have some protections to limit your own contact, because it makes it easier for you to maintain personal hygiene, there is really no documented or evidence of any exposures coming through skin contact. And airborne, it's very limited. There's some research that suggests a possibility, but more and more is going towards this droplet spread. So. Right. Can we have the next slide? I'm not able to.
Yeah, I'll take over the slide things for you then.
Perfect. Thank you.
Okay.
All right. So what to do if your workers experience flu-like symptoms? First thing, of course, is tell your supervisor, right? Don't take a Sudafed in the corner and hide in the workplace and, wait out the day. Definitely a no-no. You want to physically distance from colleagues and leave the workplace, right? Seek medical advice from a healthcare professional, right? So 911, of course, if it's urgent. 811, of course, is a very good line to call for specific medical health information. And there's also that self-assessment tool, which you may want to give a try if you're feeling, am I in that criteria? Should I call someone? You can always go through that tool. And of course, you want to consult an appropriate healthcare professional before returning to work. And that's it for that slide. All right, and we can skip over to the next one, if you please. Okay, so now we've kind of reviewed the basics. Now we look at the basic control measures. So knowing what we know about droplet spread transmission, that's where this physical distancing is really that key pivotal role, right? Even if they, in my world, I just assume everyone's infected. I'm not trying to be a fear monger. I know that that's not reality, but it just helps me to keep recalibrating, okay, what are the controls that I need to have in place that will protect me if these people around me were sick or carrying or shedding, symptomatic or not, right? So physical distancing, 6 feet. We know that so far, based on the evidence, that's telling us that is a reasonable amount of distance to be protective, right? Cleaning and disinfecting, right, as appropriate. Of course, a lot of places are increasing their intervals, especially with those frequently touched surfaces, doorknobs, light switches, that sort of thing. Personal hygiene, right? Still amazes me. There's still some struggles with proper coughing and sneezing etiquette, right? So at the end of the day, do what you need to do to keep those, droplets to yourself, right? In the picture, it said that vampire snuff, right? You're gonna cover as much as possible. But then maybe you're in a scenario where you don't want to contaminate your clothing because you're going to be wearing that and you're going to be doing other things. So if you have access to a tissue or some other way to block that, that you could remove, get rid of the tissue right afterwards, you want to do that, of course. And then washing hands and always avoiding touching your face. And I know we say that as if it's an easy thing, and I don't know that how easy that is. I catch myself doing it regularly. I hear on the B100 radio station, they kept saying, "Oh, I touched my face again. Oh no, I touched my face." So it's easier said than done, but that is a way, if you have touched a contaminated surface, that you could introduce that into your mouth, nose, or eyes, and then potentially become infected with the virus yourself. And then, of course, the basics: not sharing food, drinks, or other items, trying to limit that. Okay, we can go on to the next slide. So looking at the hierarchy of controls, I know that's something that is probably new to a lot of people, and old news for others. But it's really critical, because what it tells you is how effective the control is going to be, right? So if you can eliminate the hazard, imagine a world without COVID. Well, that's not really going to happen, right? We have it and we have to deal with it. But how can we eliminate that from workplaces? And some of the most basic things, of course, is if you know someone has traveled or is at risk, or is symptomatic, keep them out of your workplace, right? And the same goes for, if you have customers coming in. And that's something, I know it's a balance for business owners, right? You want to maintain that customer's relationship, customers, service, that sort of thing, but don't give away your control, right? It's an employer's responsibility, and workers, to the extent that they have to follow the work procedures by their employer, to maintain the health and safety of that workplace, right? So if you've got a customer coming in that's coughing and sneezing and making a mess everywhere and touching everything and not following proper protocols, that's obviously something you want to have some kind of plan in place to, how are you going to deal with those type of scenarios in a way that doesn't also create new problems, right? Like, you don't want to have someone like you get out of here and being disrespectful and potentially escalating to a situation where violence could occur to workers or other persons. So that's one thing you want to keep in mind. Another way to eliminate is, of course, reducing the number of workers and persons coming in total, right? And that's not an option for everyone. But I know there's some strict requirements and some guideline material coming out for the Public Health Office with respect to capacities, right? If you're looking at reopening a restaurant, it kind of says right in there, you should be at about 50% your normal capacity. So in a way, that is kind of a part of elimination of the hazard. The other next thing in place, of course, is engineering, right? Where we have to be in the workplace, and we may be exposed. How do we engineer that out? Well, that is not an easy question to answer, right? Because it's going to depend on the workplace. Some of the most basic things that we're seeing out there already will be things like plexiglass screens, right? To limit that droplet spread between persons. Other things might be a little more sophisticated, right? We may be looking, when we look at healthcare, we may be in scenarios where we have specialized ventilation, for example, that's localized and helps draw those any expelled contaminants away from the workplace. Another control, of course, is administrative, and that's where you get into cleaning. We get into keeping those, the stripes on the ground to keep people 6 meters apart. Signage that's up there. Other things, procedures, of course, so that everyone knows what they need to do. And then PPE is the last rung, and of course it is, because it's really wildly variable how effective it is, depending on the type, how it's used, how consistently it's used. It can, people wearing gloves, and then they're not changing them. They may be spreading contaminants at a greater rate than they would if they were just being cognizant of, oh, I've touched all these things, I better go wash my hands now. So PPE is a really tricky one, and it's not without faults. I mean, it's one thing to tell somebody to, you know, don a face covering. Well, what if that person has COPD or a heart condition, and maybe it's makes that increased difficulty in breathing may not always be the best answer. But in some scenarios, we are going to have to look at PPE if there are some vulnerabilities in the other controls. So for each workplace, how this is going to look is going to be a combination of these things, hopefully with more and more emphasis on the top levels, right? Elimination or engineering. But we understand that administrative and PPE are other tools in the box, and we're going to need to implement those as well as appropriate.
So Candice, two or three questions came up. Maybe you can clarify if we can answer them here or later in the show. One question is, do you have videos or resources regarding proper cleaning and disinfecting techniques? For example, using one wipe for every doorknob. Oh, Candice froze.
That's a really good question. Oh, back?
There you go. Yeah.
Sorry, I keep getting this message. My internet connection's unstable. Of course. That is a very good question. And I know we do have a lot of resources that have just been added within the last couple of days in terms of specifics. I know there was a really good, I think it was like a 2-page infogram or whatnot. It wasn't made by us, but I think it came out of the BC CDC on disinfectants, and it was really slick. And it just kind of talks about some of the basic things to make sure, you know, does the product you're using have a DIN number, a drug identification number? Talks about things like contact time and how important that is, because there's all kinds of cleaning preparations out there, but they're only as good as how well they're used. But I don't want to say, yes, for sure, we have something specific about cleaning surfaces, but I do know we have a number of things on the website right now. So I would definitely recommend having a look at on there, and if there are some other specific things that they're looking for, maybe I can touch base after and maybe compile those resources and send them out.
One other question, again, let me know if we can address it at the end of the show or end of the presentation. Is specific ventilation required?
So, okay, so the short answer is no.
Okay.
I mean, we expect there to be, I mean, workplaces are supposed to have engineered ventilation. Depending on the workplace, it should meet ASHRAE standards if it's kind of an office type scenario. If they're already generating hazards, like if you're in a automotive repair shop or a welding shop, there's already regulations in place for you to have local exhaust ventilation and other things. With respect to COVID-19, at this stage, I mean, the type of ventilation controls that would be required would be quite sophisticated. Some employers may be in a scenario where because of the sensitivity of the kind of work they're doing, for example, if you need to maintain a sterile room in a hospital, yeah, you're going to need ventilation. But for the majority, I think, of people that are tuned in for today, that's really not something that we're really going to be looking at as your main control. It's very costly. It takes a lot of engineering. It may not be practicable. Yeah, I think going forward, as we learn more about this risk, there may be changes to that. But for now, it wouldn't be something, say, as an officer, that I would be going in and going, oh, where's your ventilation for COVID? No, that's not really where we're at right now. Okay, so there's no more questions on that?
No.
Okay. So what should employers do? So at a very high level, we've got some guidance, determining who should be at the workplace, right? Creating policies that are in line with the recommendations of our BC CDC and the provincial health officers. So all of our resources that are available on the website right now, they're all aligned. We are towing the line. Whatever BC CDC says and Dr. Bonnie Henry says, we are aligning our resources to match that. So you don't find yourself in a situation where you're just inundated with resources and have a risk of not being compliant with one agency or the other. So we're really working together on that. Considering engineering controls, so again, we talked about that. Plexiglass barriers would be a good example of an engineering control, and implementing physical distancing, right? So, and that's going to look differently for different types of operations, but those are some of the basics that we should be doing. Okay, we can go to the next slide. All right, workers and vehicles, right? Some of us have to travel. Wherever possible, you know, we're limiting non-essential travel, right? That's a good thing to do. Also, if there is an option for people to drive their own vehicles to a workplace, then that's something you'd like to do. But there is also that other side of it. So if people are going to be driving alone on work time, then you need to consider that you may need to look at some working alone procedures or call-ins or something. More that goes into place.
Candice,
It's
we
not
kind
always
of
practical
faded out there
for
for a
some
second.
other things that are going to happen. Can you hear me again now?
There, yeah, you faded out there for a bit.
Okay, I'll just go back about 3 seconds. So if you are in a situation where you have to be traveling in a vehicle with someone, couple things you want to consider, because that would be the top of the chain, right? You're going to eliminate, okay, I'm only going to drive by myself, so there's no one else who's going to be, you know, creating a hazard for me. At that point, if you can't do that, then you want to look at the distancing. Do I have enough room to be able to distance? Maybe, are you reaching that 6, you know, feet minimum? Maybe not. So in that scenario, you may be looking at wearing, you know, some kind of protective covering, non-medical, to help keep all of your droplets to yourself. And there was a recent Harvard modeling study that said something about the effectiveness of keeping the windows rolled down somewhat to help reduce airborne contaminants. So there's a couple things that you'd want to consider, of course, depending on the situation. And of course, hygiene and things we've already discussed. Go to the next slide. All right, hygiene and training. So this one's pretty straightforward, and there's lots of extra resources on this, right from the BC CDC, and WorkSafe's pretty much stolen from there and, you know, combined it with some of our other resources. But it's really important that workers have the supplies, that they're the right supplies, that they have training, right? You know, that they're using them properly, and that you're looking at those high contact areas, and limiting shared items, right? And this is really going to be an interesting thing for small businesses, right? Where you have, maybe you're offering tea to clients when they come in. Well, maybe you need to kind of scale that back for a while. Maybe you have magazines and other things that, you know, are available. Maybe you shouldn't be doing that as well. I've seen one employer's plan, which I thought was really interesting, was they have strict instructions to people that are coming in for service or treatment, that they're to leave any extra stuff in their vehicles, right? So if they have coats and sweaters and things that they're going to take off when they come in, they leave them in their car, right? And they come in when it's their appointment. They're not given any extra, you know, drinks or foods or anything, and they're not bringing any of their own. They just come in for their service. Um, and that way they're limiting those extra items, you know, for people in childcare settings or other things. Maybe they're looking at removing some of the more porous things like stuffed animals or things that aren't easy to disinfect, or things that can't really be thrown into a washing machine and dryer readily. So once you do all that, because these are all administrative controls, right? You're cleaning things up, you're limiting things coming in, but they're only as good as people's training, right? And supervision, right? So there is some requirement there, of course, under the general duty to make sure that people understand and that they're being held accountable to that. Okay, go to the next slide. Sorry, remove this animal. Working at home. Okay, joint health and safety committees. And workers. Okay, so basically, and this is going to be something that's really interesting going forward because we're dealing with a lot of maybe smaller businesses that probably don't have a formal joint health and safety committee, right? And you don't need to have one if you have less than 20 workers, right? So what does it look like for those smaller groups? Well, if you have between 9 and 20, you should have an elective worker health and safety rep, and they should be involved in developing your plan and monitoring whether the controls you've selected are actually effective, right? And when you have less than that, then you just want to make sure you're getting that right sampling of workers, right? Make sure that they have a voice, because not only will they maybe see things that the employer may have missed, they can also have more buy-in, right? And they understand how these controls came to be selected for this particular workplace. Okay, we can go on to the next slide.
It's slow.
Okay, so what do workers need to do? I mean, we always talk about employer duties, right? And the employers do have, of course, the greater burden because they're the decision makers. They have all the authority. But workers need to also be pulling their role as well. They need to follow the procedures that the employer has in place. They need to know when not to come to work, right? Again, if they're waking up with the sniffles, it's not a matter of taking a Sudafed and a, right, and a Neocitrin or what have you and coming into work. Being very transparent about what's going on and having that conversation. Of course, practicing physical distancing and doing the right protocols. And as humans, we're all very social, right? And I see it going out and about, and people are like, oh, wait, oh, stay back. And we're trying to do the right thing. Consistency is really key, and having that gentle coaching of each other. I went to the grocery store the other day, and a very lovely person packed all my stuff, and then they went to hand me the bags. But for me to grab the bags, I'm within that zone, right? All the best of intentions, but again, it's a teaching moment, right? Like, oh, maybe we should reevaluate how we're doing this, right? How our training is, what our procedure is. Maybe it's a matter of packing the bags and leaving them for the person to come in, or some other method, right? But at the end of the day, you want to try and maintain the best way for your application to maintain the distance and the cleaning. Workers need to know about reporting hazards and refusing unsafe work and following the process, right? So if you're a worker and you find yourself in a situation where you just don't feel that the employer's controls are protecting you, then you need to have that conversation, right? First, you go to your supervisor and say, look, this is, I don't feel comfortable here. This is why. Explain. And then if the supervisor isn't able to remedy that for you, then the next step, of course, is to get in another worker rep, and you're having that discussion, right? That consultation. Okay, why isn't it working? What can we do differently? Okay, let's do that or not. And if there still is a discrepancy there between what the worker feels is safe and reasonable than what the supervisor or management has proposed, then at that stage, WorkSafe could be called and we could help mediate that. Then the last step, of course, is to take steps to minimize exposure to COVID while away from work, right? So you don't want a worker who's working in a child care facility to be off at a party on the weekend with 30 people in close proximity and then show up for work on the Monday. So just taking those basic reasonable steps.
So Candice, there's a question. Do contact information protocols follow under WorkSafe requirements?
Contact protocols? So,
yeah,
okay.
Contact information protocols. Let's see if I can find Richard's name here. I can ask him specifically.
So contact with other persons, like maintaining that distance, that sort of thing.
Oh, here he is. Wait a minute. Richard? Oh, we might have to address this at the bottom then, or at the end, because yeah, I can't quite get a hold of him.
Well, I mean, just at a high level, so in terms of some of the specific requirements for distancing and public health, whatever, it's more it's the public health officers that are really enforcing some of those details. On our side from WorkSafe, what we're looking at is the general duty, right, under the Act. I think it's 21.2 now that we've changed our numbering system. In the new, or in the Act, we of course expect the employer to take reasonable precautions. So in there, we're putting in all of these more, these orders from public health and that sort of thing. So I don't know if that answers the question, but I can certainly revisit that after we can get more information from Richard.
So I think Richard means people who come into the building. He's mentioned it in his comments.
People coming into the building. So what kind of like coming into your business, or?
I think that must mean what he means.
Yeah, Richard here. I'm just concerned about people coming into the building, into your retail, and having to keep track of who was in on that day, just in case something does arise.
Yes, yes, that's a really good question. And I actually just did read something about that. It was in the public health guidance documents, and they were talking about restaurants and that sort of thing. And they were asking for employers to, if they can, it wasn't like a must, if they can get some contact information for at least one person per group, so that if a public health officer needed to contact them later because of potential exposure, then they could do that. On our side, we are not enforcing that. I mean, that's beyond our authority. But if you find yourself in a situation that it makes sense to be able to do that, the public health authority would appreciate it, but it's not a must do. That you have to collect information from every person entering. Yeah, that just wouldn't really be very feasible, I think, for a lot of workplaces right now.
I think we can move to is this the next slide already?
Safe operation, yes,
Okay.
yes. So when this presentation was put together, we were still in phase 1. We hadn't rolled out phase 2 yet. So of course, everyone here knows phase 2 is come online. This is probably the biggest phase of reopening in terms of the number of businesses. So we've been working really hard to figure out how can we best help business owners right now, employers and workers, to get back safely, and of course build that confidence in the customers coming in so that they can feel safe coming out. So part of that strategy is, of course, a lot of industry specific resources are being put out on our WorkSafe website, and they're all split up. I think we have like a phase 1 tab that has stuff that was existing before. And then of course with the phase 2, we have some specific documents there. With the public health orders that have recently come out, there is a requirement to post those COVID-19 safety plans, and also make them available on the website if you're an employer who has a website. So, and that applies not only to phase 2 businesses, but also for anyone that was open as part of phase 1, the essentials. So the other part of that is I think probably a lot of people are wondering about what are the regulators going to do? Are we going to come in and give everyone a hard time right now? And the answer is definitely not. We are taking a consultative approach over the next couple of weeks with employers. We've all been assigned different areas, if you will. Like I got hair and nails and tanning salons, for example, as an area officer here in Kamloops. So I'll be reaching out to those employers and having a conversation about, okay, what's your plan look like? And it's not an expectation of perfection, right? This is a working document. Everything's evolving, everything's fluid. We expect there to be basics in place, and we're going to have that conversation and help kind of fill in any gaps that might be there, get an idea of where you are at, and then we'll be writing a report to kind of capture some of those key points. We're really very reluctant to be issuing any orders at this time. Of course, if we see high risk violations, you've got someone hanging off of a roof, 20 feet in the air, we're obviously not going to be looking the other way. But when it comes to COVID and these plans, the idea is to help support, reach out to as many employers as we can. We also have our information line. So if you have other questions that don't get answered here today, And I think there's some contact information on a later slide. We definitely hope that you'll give us a call and ask those specific questions, and we'll help guide you there.
So Candice, we have some questions for you. Do you have a link to the public health document that you referred to? And can you share this link?
Was that the one with the in the restaurants? The one about getting information from customers?
Bob, can you? It regards the contact tracing document.
Yeah, I can send the link there for sure. Yeah, I just finished reading it like probably an hour before doing this presentation. So yes, I know where it is, and I'll be able. It's one of the guidance documents that's on the public health website. But certainly I can send that. I think what I'll do, maybe Christine or Samantha, I'll send you some of these resources that have been specifically requested, so that you can get them quickly. Is that?
Yeah.
Okay.
That's great.
So I know there's a lot of questions that are coming up. I'm going to save a few of these more for the end here so that we can get through, because we're already halfway through and we have quite a few more slides. So Candice, you haven't addressed this slide yet, have you?
No, but I think we already kind of talked about it. So it's the safety plan. So we do have a template that's available, and we're going to talk a little bit about that at the end. If anyone who's interested in staying for an extra 5 minutes or so, we discussed maybe doing a bit of a kind of a mock scenario, kind of go through how you can fill out one of these plans for yourself. Using the template, although it's not mandatory, it will align you with what the public health orders want, and hopefully provide some structure to you when you're doing this on your own for your workplace, right? So it's going to address your specific workplace, the activities that are carried out, and what you need to have done there, and how changes and precautions will be communicated. So looking at the training piece. Okay, we can go to the next one.
Aha, support.
All right. So this is where we get into some of the extra materials. So WorkSafeBC.com. If you go on there, you'll see right here in the slide at the top, it's got the COVID stuff is right in the forefront. You click on there, it's going to bring you to all of our specific information on COVID. There's lots. Again, we're constantly evolving our materials. And if you have some very detailed technical type questions that aren't already answered, we do have a couple of teams in our Richmond head office that are dedicated to helping us bring the right people together, you know, our own engineers and public health reps and whatnot, to get some reasonable answers to these technical questions where they come up. Okay, we can go to the next slide. Okay, and again, just some more links here for the online resources. Couple numbers to call. There is an additional phone number. Actually, no, it's not additional. It's the SAFE. So this is the number that you're going to call. This 1-888-621-7233. That's our General Information Center line. And you will be connected with prevention officers. We all take turns on that desk and answer questions as they come in. So that's the quickest way. I mean, I'm happy to answer questions, but I mean, I also, after this, have inspections to do. And so I'm not always the best person in terms of getting a timely response. But that number, you call them and they'll connect you with someone right away.
Also, I will make this slideshow into a PDF where all the links are clickable, so that if you see it here, you can pick it and it will take you to the correct website.
Thank you, Christine. Okay, so the next slide is a little bit about claims. Now, as a prevention officer, this is definitely not my area of expertise. I think it's important information to let people know out there that these services are still continuing on, right? We're still supporting, payments are continuing. There have been some modifications that make it a little more online friendly. Recognizing that not everyone is going to have the same level of capacity to access online, so we still have the phone number, but definitely any questions related to claims, you'll want to contact that department and use the portal. It is very secure, so you can ask confidential questions through that portal, which is a new feature.
Whoops.
All right, and then here's just another link to, or another slide showing all of the different links. As I said before, all of our materials are lined up with what our BC CDC says and Dr. Bonnie Henry. We're just trying to help employers filling in those gaps of where they may need a little extra assistance. But definitely some good places to check out, as well as the 811, and we talked about that earlier. If you're having symptoms, need some medical type information, that's the number you want to call. And then of course the 188 COVID-19 is for your non-medical information. So for public, not workplace related stuff, essentially.
Whoops.
Okay, and I think we're getting near the end. We think we have one more slide here. Of course, we have listed some more of the resources that are available. I won't speak too much to that because those are, as I mentioned to Christine before the presentation, it's Russian dolls. You go into one and there's more information and more, but these are definitely some very good materials or resources for extra materials if you would like to delve into those. And I think that brings us to any final questions or concerns. Again, right after we do some of these questions, I do want to invite people to stick around if you did want to have a look-see on how to fill out one of these plans. We're going to do a hypothetical scenario, and it might just give you some ideas and be a little less intimidated when you're putting this together, because there is a lot out there.
Okay, so just to address some of the questions from the chat, which there's quite a few. All right.
Should I
come back to here? What are the restaurant guidelines for dine-in? For example, serving while maintaining 6 feet, or are restaurants supposed to continue takeout only?
No. So the answer is that there will be some dine-in is being supported. We actually did just put a WorkSafe specific information package, if you will, on the website that speaks to that. So just going off memory, I just read it just a while ago, but some of the rules in there, of course, are going to be social distancing, right? So you want your tables set up so that one party is at least, 6 feet from the next party. You want to make sure that your servers are also able to maintain that distance. So yes, there is going to be reduced capacity. There are some formulas that have been put together, and this isn't by WorkSafe. I think this comes from public health folks, that talks about how many people per square feet that you have in your business, and you're going to of course subtract any things that detract from that floor space. But they do have some very good recommendations in there on both our resource and linking back to the public health on how to basically safely set up your safe work plan for restaurants for dine-in.
I have some questions that were emailed to me. Question 1, if a staff cannot maintain 2-meter distance, is it paramount to wear masks? Because she hears a lot of negative and positive opinions about the mask and isn't sure which is better.
Absolutely. So it's a really good question. And right off the hop, I'm going to say it always depends. It depends on the scenario. So if you can't maintain distance, then yes, you need to do some other control, right? So if we look on the hierarchy, I mean, preferably, like let's say I wanted to do a facial on somebody, and so that requires me to be very close to that person. So if I'm that close, I'd want to be wearing a covering to protect them, and I'd want them to wear a protective covering to protect me from droplets. How am I going to do a facial with someone wearing a mask, right? Not gonna happen. But maybe I'm a very sophisticated, rich, fancy place, and I have special ventilation place where this person lays down on the table, and there's a kind of a thing where I can put my hands in, and all the vent is pulling that person's air back into a local exhaust. Now, this is not an expectation for people, but this is just something to think about if I'm looking at controls. Would I need to have a mask in that scenario? I would probably still need to wear a mask as I was providing the service, because I want to prevent those droplets from landing on the person as I'm doing it. But I wouldn't be as worried about getting exposure from them, because the air would be pulling those contaminants away. Now, that's a very specialized example. But if we look to what Dr. Teresa Tam is telling people, and what's being proposed out there, and this is the most recent information, is they are suggesting that a covering, non-medical covering, can help reduce the transmission in terms of droplets. So if everybody is wearing them that is in that, that can't be separated by distance, then that is thought to be a form of control. So yes, if they're used properly. Now, we know that it's nose, mouth, and eyes. So if we're within a close proximity to someone, maybe just a mask covering isn't enough. Maybe there also needs to be some consideration of the eyes as well. So it depends on the scenario, right? So you really need to unpack that. What are you doing? Why am I so close to this person? If I have to be close, is this the right protection? So those are things that need to be sorted out on a case-by-case basis.
So it makes sense that her second question, oh, sorry. So her second question was, is a face shield considered a viable option? So if you're really concerned, you wear a face mask and a face shield.
Yeah, so with that combination, you're going to not only prevent yourself from expelling droplets into the area where they could impact others, but you're also protecting the eyes with the face shield. Absolutely.
Can two tables be sat side by side if they are separated by a booth of 2 meters high? I imagine a booth back.
So we're talking kind of like a barrier, essentially.
Yeah.
I mean, it's very tricky for me without seeing and speaking to the specific scenario, but really, to me, it sounds reasonable. It sounds like a barrier, right? If you've got a barrier in place and there's really no physical ability for those droplets to go to the next group of people, yeah, I mean, again, is seeing the scenario, of course, but at a high level, it does seem to be reasonable that could be considered an engineering control, really.
The last one from this email, are customers allowed to walk between the tables that are 2 meters apart? Because of course that makes the customer closer than 2 meters to those tables that they are passing.
So really, if I interpret what's being put out there by the Public Health Authority in our own documents, really, you don't want anybody to be violating the distance rules, right? So you really want to set up your workplace so that workers and customers understand they understand the requirement to be distant, and that you've designed your workplace to facilitate that, right? So people shouldn't be crisscrossing over. I see some businesses have successfully done this already by putting arrows. You have one way, you might have to move furniture around, but you really, to me, that's an unnecessary lack of control, right? Why do these people need to be walking in proximity in the first place? That would be the question. Is there a way to engineer that out? Or administratively deal with it with some kind of procedure?
So I have another question from Diana. It says, is it required for clients to wear a face mask while getting a haircut? We have it on our COVID-19 safety plan. We have posted it, but as a barber, I feel like many may not want to, and how should we address someone who doesn't want to wear one? And for those getting a beard trim, do they just take off their mask for the 10 minutes of trim?
Okay, so both really good questions. Now, with the beard trim, that's a tricky one, right? Because really, if you're going to be within that 6 feet, you need to have a control, right? So whether or not there's some other way to put a barrier between the person getting the beard trim and the worker, that's going to be something that'll have to be looked into. And I don't have a direct answer. for that on the spot, but I mean, there may be some type of option where there's some kind of a shield that's worn by the client while they're getting their beard trimmed just to stop that blockage. But at the end of the day, you can't not break the distance. You can't break the distance rules and then not have another layer of protection, right? Now with clients in a hairdressing situation, again, all those rules are out there already. Those guidance documents that say maintain distancing. Well, in hairdressing, I mean, we don't have, our arms are not, 12 feet long, and, we have to get close. So in order for these masks, these coverings to be effective, both parties that are involved in that breaching of the distance need to be keeping those droplets to themselves. So it's perfectly reasonable to put that requirement in place for your clients. I think in the near future, communication is going to be the key, right? Making sure that clients know in advance, okay, this is how we're set up. And I've already received emails just as a customer to places in town of what they're planning to do and laying all that out in advance and then having the signs in place. And I think people at this stage, the general public, I mean, we really need to be aware and be respectful of those rules that are being put out there to protect workers in BC, right? And each other, right? And non-workers. So I think it's perfectly reasonable to have the masks. Is it a requirement? Again, it depends if there are other controls in place. If, again, you're a very fancy, sophisticated hair salon where everyone's under some kind of a local exhaust, which I don't think is the case, then maybe the mask is not necessary. For all the other levels, if you're missing those, then you need to be defaulting to the PPE as a minimum. I hope that answers that question.
We have another question from Greg. Now that we're allowed 50% capacity in restaurants, does this include everyone in the restaurant or just the customers in the seats, the 50%?
So for that question, what I would do is I'm going to recommend to go back to that guidance document because what that talks about is also, because there's the 50% capacity, which on first glance, I'm thinking applies to the customers, but there's also the rule of how many people you have in one location based on the square footage. And that, again, that's not put out by WorkSafe. That guidance document came right from the Public Health Authority. And I'm going to share that document with Samantha and Christine, with you guys, so that you can put that out to the group. Because I would suggest having a read of that, just making sure that you're meeting all those tick boxes. Because I don't think that it did refer to workers, but there is that higher level rule of how many people together in the same place.
Okay. We have another question from Patty about retail. It says, how do businesses regulate and clean fitting rooms? Will they be allowed? What about clothes that have been tried on?
I was so worried that I was going to get that question. And I'll tell you why, because I don't have the answer. So with the change rooms, it's very easy to, I mean, if they're hard surfaces, you apply your standard cleaning agent, disinfectant, no problem. Clothing, yeah. I mean, I look at what we're telling hotel people to do. Like in hotels, for example, if someone is staying in a room and they're not checking out that evening, then housekeeping doesn't even go in there. The person, if they want new sheets, they pull their sheets off, put them in a bag, and leave them out the door. Yeah, I think that's an area where that is a question that I think is worthy of follow-up, and I'm going to put that up to my senior management folks and see what they have to say about it, because it does make me feel uncomfortable. I think there could be potential risk there, and I'm not sure what the answer is, so I'm going to flag that. That's a good question. Thank you.
One of them was, where do we post this COVID safety plan?
Well, that is a good question too. So what the public health order says is to make sure that it's posted on the employer's website, as well as in the workplace. And it doesn't really provide any more specifics. So basically it's where it would be readily available to workers of the workplace.
Okay. The next question is, would safety glasses be equivalent to a face shield, and where should we be? Oh, that's already asked.
Sorry, I asked that one. Are safety glasses equivalent to a face shield? Yeah.
Well, so I mean, no. I mean, they're different. They're different items with different purposes. The face shield is nice because it covers more surface area. But if you're already wearing something over your nose and mouth, then safety glasses can add that barrier for the eyes. And again, like considering the type of safety glass, what they're doing, like if they're doing a job where they're leaned over someone and the glasses are sliding off their face, is there an opportunity for things to get around them? Like all of these details, they kind of matter, right? They matter to be considered in the scenario. Sometimes safety glasses will be great and adequate, and sometimes a face shield will be more adequate and suitable to the situation. So that all needs to be teased out. It depends. I'm sorry, that's a really terrible answer, but a lot of this depends on the scenario. Yeah.
Thank you, Candice. Another question about restaurants. Should they be using their own cutlery or take-out cutlery? It might also be a hazard for the server they're working or washing the cutlery if they have their own.
So what I've read in our publications today, there was some conversation or some literature on certain like plates and forks and whatnot, and they were saying there's no issue there. I mean, once, you know, as long as you're following the same protocols you would follow in food safety anyways, you know, you're collecting those dishes, they're going into, you know, dishwashing equipment that's going to kill the virus, very easy to kill. So dishwasher, dryers, that stuff, it's game over for COVID-19. So yeah, based on the literature I've read, there was no, like we're talking about in restaurants, yeah, providing cutlery and bringing it back to the proper dishwashing wasn't listed as an issue. Yeah, hopefully that answers that question.
Okay. There's another question on Facebook. Will businesses have some kind of notice that says that this business has been inspected by the safety officer while entering the building? Anything of that sort?
So, well, typically the way we do business is when we do an inspection, it's confidential between ourselves and the employer, right? We provide a copy of the report to the employer. They're supposed to post it for workers, right? So everyone in the workplace, there's no obligation for them to share that information with the public. Having said that, it's their document. Once we give it to them, if they would like to post that they've had a check-in, then that's their prerogative, but there's definitely no requirement for them to do so.
Okay, thank you.
Is WorkSafe able to close a business for infractions or send out warnings? And will public be aware of warnings?
So, well, again, so I mean, WorkSafe does have that authority under certain circumstances. COVID-19 is really not one of those circumstances where we're looking to be shutting down businesses. As I said earlier, we are not, we're looking to be more consultative during these next few weeks as we help employers figure out what's the best way to control these hazards. I mean, if we go in and we see there's asbestos ripped out of the walls because they were making COVID controls, well, now we're getting into a different context, right? We're looking at an asbestos hazard. So only in those high risk type situations will we consider doing a stop work. Otherwise, like I said, we're doing consultative. We're looking to have those conversations with employers about their COVID plans, providing some guidance. We're writing some reports to document that conversation. And after that, it would only be if we got some repeated calls from that workplace where the employer said they were doing all of this wonderful stuff and then they really weren't, and consistently not, dealing with issues coming from their workers. Then that would be a different type of scenario. But definitely, we're not going in and shutting down workplaces related to COVID. That's not in our strategy at all.
And it looks like you've covered all the questions. So we also have this case study of a sorts that Candice would like to go over. For those, I know that we're going past the 1 hour. Feel free to stay and follow through or listen to what she's suggesting here for a case study. I'll come back to that slide. If you have to go because the hour is up, thank you all very much for participating. I really appreciate it. And if you are interested, I just posted a poll if you would like to participate. It's just checking to see if we can do anything better, if we can provide some more information, or very specifically, if possibly, we're looking at yet another webinar, which I think would be fantastic, because Candice, this is great to have you answer all these questions that I'm sure there's going to be a lot more questions about too, so appreciate it. So I'm going to go back to our case study. Excuse me. And we'll just, there we go. So we're on that first page. For those who are leaving, thank you very much. We'll keep, yes, the slideshow will be shareable. I will turn it into a PDF so that all the links will be clickable. And I think that's a real word. And yes, we'll share this. And I have been recording it so that we can post it all to our website as well. So those who have missed anything or think of some other questions will be able to rewatch it. And then again, email me with any of your other questions and I can make sure that it gets either answered by our resources or through Candice's resources. So thank you all very much. Looks like we have 43 people staying. So take it away, Candice, you got some more.
I will try to go through this fairly quickly. But just so this document is available online, of course. And if you follow this document, this will meet all of the bits and parts that you need to be compliant with us, as well as with public health. So the first section, step 1, is all about assessing risk, identifying risk. And again, it circles back to getting that involvement of your workers, right? Your worker reps committees, if you have one, and looking at, you know, where are those areas of conglomeration. So if I was looking at a hair salon or an aesthetics facility, I'm coming in, so the front desk is going to be a busy area, right? People maybe are buying products, maybe people are checking in, they're leaving, you know, making appointments. So this could be a particular danger zone, if you will, for distancing. So you identify that, that could be a possible area that I need to solve, right? There's risks there. We might look at common areas, okay? So in the back of the salon, we have our little meeting room with 3 chairs and we've got 12 stylists and they all like to go for break at the same time or 6 at a time or whatnot. So that could be another area that you look at. Oh, okay, we're going to have to look at that as a potential risk. You may look, and again, we're focusing on hair salons just because it's easier for us to look at one particular industry to go through this. But other areas you might look at would be where they mix colors, right? There's a lot of people coming in and they're all going through the same area, maybe touching the same cupboards and supplies. Is that another risk area that needs to be addressed? You're selling product. People are touching the product and they want samples. That's a potential risk. You're offering coffee and tea when people come in, and hand creams. And again, we have a lot of contact. So you want to go through and look at your layout and pick out those areas, those shared tools, kind of drilling down, okay, these are all things that we need to maybe control, right? So that's when you look to step 2. And again, we have some really good industry specific protocols. So if we were looking at how do we reduce the congestion at the front desk? Well, maybe we have a solution that involves, okay, if people want retail product, they need to call us, right? Call us and maybe they know what product they want and it's arranged like a curbside type scenario. Or maybe we arrange times like, oh, you need specific product. Well, we know that there won't be any appointments coming and going at time X. So time X is a good time for you to come and look at product. Limiting handling of product. Maybe you decide we're just not offering tea and and cream samples right now because it's just because of the way of the world. So you're looking at those different possible controls, right? Maybe you're not letting in walk-ins, right? And being successful at a lot of this is going to be hugely tied to how you communicate it, right? Being transparent, right? Being honest about your risk and what your expectation is, and following through, right? With like your expectations with clients as well as amongst the workers. Looking at potentially PPE. If we're in a salon and I'm close to people, maybe every customer that comes in the door is wearing a face covering, right? That could be a control. People that are sick, obviously customers, you might want to massage your policy a little, because I know there's cancellation issues. People get charged full price if they cancel last minute. Maybe you want to look at how you can balance that, where you're maybe adjusting it so that you're not encouraging people to do, as I mentioned earlier, they're all sniffly and they have symptoms, but they don't want to get charged for that appointment, so they're going to take a bunch of stuff and potentially come and get their hair done and shed that around. So there's a number of different controls that you're going to want to look at to kind of maintain that flow. For your break areas, maybe you're encouraging people to go for breaks outside. I mean, summer right now, so that's definitely helpful. At the very least, you're going to limit how many people are in there at the same time, right? Staggering those breaks, because we always want to limit those meetings. So, and of course the sanitation, right? Doorknobs, shared tools. I mean, I know a lot of professional stylists have their own equipment, but then they're sharing some of the chemicals. You're going to want to look at maybe if there's some changes required there to the flow. And we can probably go to the next part, and we already talked about a lot of this, and that's looking at this hierarchy of controls, right? And you're looking at the salon going, okay, how do we eliminate? Well, first, let's keep the sick people away. They can reschedule. Maybe if you're a very tightly packed salon, maybe you're staggering or moving the furniture so you're only having a person in every second spot. Engineering, pretty hard to put up a plexiglass barrier and still be able to cut someone's hair or do a coloring, so that might not be practicable. So you may have to look more at the administrative controls and potentially the PPE. So the rest, like the next few pages, basically provide you some physical space on the document to be able to add any of your own site-specific information as you see fit. Checking off the boxes. There's quite a few pages like that, so I'm not going to spend too much time on those unless you have questions. So if you are going to have masks in play, especially at a hair salon, again, being clear who's wearing them. If everyone's wearing them, just put that out there, advertise that, put signs, and then hold people accountable, right? And make sure everyone's wearing them properly. There's nothing worse than having some people wearing them under their nose, some people are wearing them on their chin with both their mouth and nose exposed, people are wearing them on their forehead. You know, obviously, having that basic information to workers especially, and for customers as they're coming in, and deciding whether is this something that we tell our clients that they need to do in advance. Maybe you're sending that email or that phone call before their appointment and saying, hey, we have implemented this precaution, and when you come in for your appointment, you need to be wearing this covering. Please don't bring your coat or any additional stuff, because we're not handling any extra materials. Leave that in your car. Right? Don't come in until your appointment time. Like, you could have all of those communicated in advance to help streamline that process. So then step 3 talks about the policies. So just kind of verbalizing some of those things that you're going to put into place, right? Developing your communication plan, right? How do you make sure all of your workers are aware? And are you providing that right training, education, and supervision to make sure that it's consistently being applied, right? Are all stylists wearing the masks? Are all clients? Or do you have those clients who are like, I'm fine. No, I'm not sick. This is allergies. What do you do, right? So workers need to have that training in advance so they can be really smooth at, backing up those policies that are in place and not letting any slip through.
Candice, what page should I be on?
I'm actually right at the end. I'm on page 9. Yes, because there's a whole bunch of pages in between, which essentially are just spots for people to fill out as they're doing one of these, right? So there's a lot of blank space. So we already talked about developing policies and then developing the communication and training plans, right? So that already brings me to page 9, which is step 5. And that's monitoring your workplace and update your plans as necessary. And I think step 5 is going to be really critical, because when you initially put together what controls you want to put in place, you may realize that the implementation of them is not as you hope. For example, you put arrows to control the one-way flow of your customers, and then one of the arrows ends up in a dead space that causes people to backtrack anyway. You know, little glitches like that you're going to notice that may create problems. So you need to be prepared to make adjustments to that plan as needed. And that's another reason why we're not expecting perfect plans, right? We don't want perfect to be the enemy of the good or the very good, right? It's a living document. So you'll see some gaps, be mindful of them and make those changes, right? And always trying to involve your worker reps or your joint health and safety committee members, if you have them, in that process, right? Because they can give you some feedback about what's working and what's not. You know, if you have this process where you know, people are told to not come in until their appointment and they're coming in anyways, and they're not really listening to the rules, well, maybe you need to step it up, right? Maybe you need to lock the door and have a sign there that says, yeah, we'll let you in when it's time. So you just kind of modify those as you go. And step 6 is assess and address risks from resuming operations. So that's just making sure that you have the training plan in place when new people come on, right? And they're taking on new roles. Any changes? And I mean, all of this seems a bit redundant almost, because this is all a big change, right? Everyone's experiencing a lot of change. But you want to make sure that as you go, every time there is a change, that everyone is in the loop on that change and they know why, right? Because that's where you're going to get the success. So I did sort of condense that quite a bit. In the sake of time, we're already pretty far over. Does anyone have any specific questions regarding how to do your plan or where to find it?
I have one question. Can inspections be requested?
Of course. Yep.
Thank you.
It looks like that's it. I think you've covered everything. I'm sure people will have more questions, and again, feel free to contact me, and I can forward them to Candice or the appropriate person, or answer them from either our resources or Candice's resources. And I will share the PDF of the slideshow. The second one with the case study, it's already a document, but I can also attach that PDF to the slideshow one. So you'll be able to read it a lot easier, because I know somebody said it was kind of small on the screen because it's in the document form instead of the nice wide PowerPoint show. So thank you, Candice. Thank you very much. It's been wonderful to have you. I'm glad that we had a lot of people responding in the chat box and email and Facebook. That's fantastic. That lets us know that what we're doing is appropriate and timely. So again, thank you very much, Candice, for all you've done. And thank you to everybody who's attended. And I guess, bye-bye. So, cheerio.
Bye.